Next in Better Health, we find out how the Southern District Health Board is supporting a smoke-free New Zealand.
Well, my name's Rose Orr. I'm a smoke-free coordinator and I work with the hospital wards to support them to support patients to provide smoke-free support. And our objective is to have a healthcare setting that supports everybody who comes in to become smoke-free.
Hi, I'm Mike Hammond. I'm a public health nurse, registered nurse with the Southern District Health Board. My key roles are working with young people, and one of those key roles is supporting young people to stop smoking.
Hi, I'm Anwyn. I'm an occupational therapist and I work for the Southern District Health Board, and I work with intellectually disabled adults in an inpatient setting.
Every time a patient will come into our hospitals, they'll be asked about their smoking, and if they do smoke, they'll be given some support to quit. And that's not intensive support, it's often recommending some NRT and recommending referral to a support service. We have a lot of support services available in our district that provide ongoing support.
My name's Sarah. I'm the Healthy Lifestyles nurse at Musselburgh Medical Centre here in Dunedin. So I run a Healthy Lifestyles clinic on a Tuesday morning for patients, and it could be ranging from anything to do with weight and diet to smoking cessation.
Well, our government has a goal to reach a smoke-free New Zealand by 2025, and what that means is that 95% of our adult population will be smoke-free. And really it's a generational goal, so that what we're concentrating on is the future for our children and our children's children.
People have been really positive about it actually, and the people that have come in wanting to make a quit attempt have had it on the back of their mind for ages, because they're seeing it out there, they're seeing all the changes and stuff, and know that they should be part of it.
I mean, you're working in the community, I see the impact that smoking has on people, you know, young people, and their families as well. So we can support young people to stop smoking and their whānau.
And our hospital offers a totally smoke-free environment for our patients. And often when people come in and they are smokers, we can offer them a lot of support to quit smoking. Things like nicotine replacement therapy, the gum, the lozenges and the patches, and also the nicotine inhaler. And those sorts of things really helped people to alleviate their cravings and to actually give up smoking.
I mean, giving up, we understand with young people, giving up can be, you know, difficult. We like to say to them, you know, it may not happen the first time, feel free to come back. And, you know, I suppose the emphasis I put on with young people is it's not so much the journey, it's the destination. The destination being, you know, you can stop, and the journey is, it can take a while.
It's a very tough thing to give up smoking, but we support them as best we can.
Well, usually people have that little bit of motivation to come here. They've decided they want to make that quit attempt, so I'm the go-to person in the practice here. So usually they come up here and we talk about what's going on for them and what their smoking habit is. We go through different options and offer therapies and support groups. If it's not just support here from me, it's also the Quit Line and other groups we have in the district. So generally I encourage that, because I know from experience that can help people to make a good quit attempt.
We put emphasis on changing routines. Sometimes it's, hey, you've these friends that are smoking, maybe is there some other friends you can spend time with to have less cigarettes? Maybe change a few routines, like if you have a cigarette first thing in the morning, can you kind of have, you know, have a drink of water, then maybe do something a bit differently in that routine. If you walk along the road to catch the bus, maybe take a different route that doesn't remind you, hey, this is about where I have my cigarette.
With a lot of our patients, it's really focusing on those other benefits, the extra money that they'll have and the health benefits that they see.
And if it gets hard, you know, find a support person, text your mates, find ways of, you know, getting good positive feedback about it.
A lot of them are able to do more exercise because they've got, it's easier for them to breathe, and just having a little bit of extra pocket money to spend is actually really, really good, instead of it all going up literally in smoke.
Well, it's really great that we know that 80% of people who do smoke want to become smoke-free, so whenever they engage with a healthcare professional or often within the community, they'll get the option of support to become smoke-free.
And we have this great connection with the hospital, that anyone that's been in hospital in admission, I get a note to say they've been, and I do a follow-up smoking cessation.
Another big goal is having smoke-free environments. We know that that makes a big difference to make sure that people can be supported to be smoke-free, but also that children are exposed to smoke-free environments. So smoke-free playgrounds, cars, homes, they all make a big difference.
Well, not only the smoke-free, but seeing all the other things that come from being smoke-free.
A lot of our patients have noticed not just the increased lung function and being able to walk a lot more easily, but things like having nicer skin and smelling nicer and those kinds of things are really important to them. So that's a really good motivator.
The best way to quit is using some cessation medication, so that might be the patches, the gum or the lozenge. There's also other subsidised products, and providing what we call ongoing behavioural support. Those are the two key factors. So if you've got a friend who's thinking about quitting, it's really good to encourage them, but also recommend that they give the Quit line a call or maybe phone one of our local providers to get the best possible support and the best chance to quit.